Hi there, my name is Janine, and my partner Shenae and I work together on answering these questions after watching the first video. So, question number one, I'm going to start by discussing the several errors made throughout the video. And some of the notable errors were number one, the nurse did not assess the patient after being told by the UAP that the patient reported itching. Is that right? No. It is the nurse's responsibility to assess the patient and to confirm the UAP's statement. Next, we also saw that the nurse recommended Benadryl for the patient without a physician's order, an assessment, or checking the patient's chart for any allergies and contraindications. It is very important to remember that just because it is an over-the-counter medication doesn't mean that it won't harm your patient, right? So that is why we always check no matter what. Third, the LPN was gathering medications in an environment that was not distraction free and continued to do so while being interrupted, and that leaves room for a lot of errors. On top of that, she also appeared to be gathering medications for multiple patients at a time instead of one patient at a time. Is that safe? No, absolutely not. And what's more is that she redelegated the task to the UAP, which is outside of the scope of their practice. Absolutely not. No dosage or route administration were discussed. The 6 routes of medication administration were not done, and the expiration date on the medication was not checked, right? And documentation was not done immediately as well. On top of that, the patient was not educated on the name of the drug, its side effects, and the potential complications. I'm also going to add the inappropriate comments from the LPN and how the nurse has not checked on the patient since being back from the HIDA scan. So that's a big no right there. Okay, question number 2. I'm going to start by stating the 6 rights of medication administration. And what are these? You have your right patient, right medication, time, dose, route, and documentation. So these rights were put to ensure patient safety and prevent medication errors. And according to Scrowers 2020, these rights must be followed as medication errors result in at least one death each day and injure approximately 1.3 million people annually in the United States alone. Imagine that. So, going back to the question, the main right that could have created a positive outcome for this patient would have been the right medication. So, we saw in the video that this patient had a documented allergy to Benadryl. But due to the negligence of the healthcare team members in following the 6 rights of medication administration, this crucial piece of information was missed. We also saw that the standard procedure for oral medication administration was neglected. A simple action such as asking the patient if she has any allergies could have resulted in a positive outcome for the patient and could have prevented her death. Okay, question number 3. Medication errors can have significant impacts on nurses, clients, their families, and organization as a whole. For nurses, it can be mentally, physically, and emotionally taxing, which can lead to burnout. Some nurses may even question their competence, right? And even face potential consequences such as losing their patient trust, going through civil legal actions, even face criminal charges and losing their license. According to Linda Macquisition, our pharmacology book, nurses who administer a drug without a licensed healthcare provider's order violate the Nurse Practice Act and can have their license revoked. In a civil court, the nurse can be prosecuted for giving the wrong drug or dosage, omitting a dose, or giving the drug by the wrong route. This is why following the 6 rights of medication administration is very important, right? And for patients and their families, they may lose their trust in the healthcare system, especially in the people involved in the error. These loss of trust can then have long-lasting effects on the patient-provider relationship. Additionally, it can result in increased healthcare costs for the patient and their family. And the worst outcome is patient injury or death, which was depicted in the video. Now, for organizations, medication errors can tarnish the reputation of healthcare organizations, leading to a loss of credibility and trust in the community. So, this is why healthcare regulatory bodies may then investigate medication errors within an organization, which can result in fines, but also mandated changes to policies to ensure compliance with regulatory standards and prevent the same medication errors from happening again in the future. Okay, for question number 4, my partner Shenae shared that her sister would have severe asthma attacks that would often require hospitalization. So, as such, her sister spent a lot of her younger years going in and out of the hospital. And based on where their parents lived, there were two main hospitals to which she would be admitted. And it was during the 1980s in the Caribbean when hospitals were still using paper charts and there was no communication between hospitals, especially rural areas. And then one day, it was discovered that Shanae's sister had a penicillin allergy, which was then documented in that hospital, right? But not to the other. So now, during one of her following hospitalizations, she was ordered penicillin, which was almost administered until Shanae's mother intervened and informed the healthcare team members about her daughter's penicillin allergy. Now, this story is very important because this was a near missed error, right? And this is a good demonstration that patients' families can be important sources of information. This is why we always take them into consideration when we're doing our plan of care. We always take that into account. We always try to include them, right? So that's all. Thank you so much for sticking and watching the video, and I hope you'll learn something. Thank you.